Well, one of our top pandemic headlines this morning has to do with CBC News learning that Canada is about to change its guidelines on mixing and matching second doses of COVID vaccines. The National Advisory Committee on Immunization set to approve the interchangeable use of AstraZeneca, Pfizer-BioNTech, or Moderna shots in certain situations. But Manitoba officials are not waiting. They are already making the change to the province's vaccine rollout.
If you are someone who received a first dose of AstraZeneca, it means that we'll be recommending that your second dose be with an mRNA vaccine, either Pfizer or Moderna. It will be your turn when you meet provincial eligibility for second doses, like those who received Pfizer or Moderna.
Now, Manitoba's decision is based on a small Spanish study of 600 people, one that found mixing vaccines provided a good immune response. If other provinces make the second dose switch, it will likely speed up Canada's effort to get people fully vaccinated, with millions of Pfizer doses now coming into the country each week. And with that, let's bring in Dr. Isaac Bogosh, infectious diseases expert, a member of Ontario's COVID-19 vaccine distribution task force. Isaac, always good to see you. Good morning.
Good morning, Michael. Good to see you as well.
So a lot to talk about here with this mixing and matching of doses. As NACI, as we said, will be changing the guidelines. I know we've, in the past weeks, referred to a definitive study that'd be coming out of the UK. Again, Manitoba looking at a small Spanish sample. So why is NACI doing this now?
I think it's fair to say that sometimes the results of these studies are shared before a peer-reviewed publication or before it becomes widely available. So I would imagine that people on NACI and have been in touch with the individuals who are conducting the study. There often is lots of communication that's happening behind the scenes. Regardless, even in the public sphere, there is growing evidence that mixing and matching vaccines, for example, a first dose of AstraZeneca followed by a second dose of an mRNA vaccine, is both safe and, as you pointed out a minute ago, provides a pretty meaningful and significant immune responses to that. And again, that's been publicly available data. We also know that France and Germany have been mixing and matching COVID-19 vaccines probably now for about 2 months. So I think there's just a growing real-world evidence plus scientific evidence demonstrating that this is a safe and effective path forward. And I think we'll start to see this integrated in Canadian settings, but also globally as well.
Okay, so Manitoba is moving ahead right now, and this is ahead of NACI. But once NACI actually gives the go-ahead, how quickly do you think the provinces will adopt this kind of strategy?
Probably very quickly, because as we do have millions and millions of Pfizer vaccines coming into the country, and that just gives a lot of opportunities for people to get vaccinated quickly if people choose to have a second dose, for example, of an mRNA vaccine. So I'd imagine it would be rather quickly implemented into real-world practice. We also know that there's many people who have had a first dose of AstraZeneca who want a second dose of AstraZeneca, and I guess it's not going to be available, for example, in Manitoba, but I believe it will be available in other parts of Canada, and I think that's also acceptable as well. The key here is enabling people to make an informed decision, right? We have to know what the benefits of these vaccines are, and clearly we can see the benefits of the AstraZeneca vaccine in, for example, the United Kingdom, where tens and tens of millions of doses have been given. We have to very transparently discuss the risks, and we know about the risk of blood clotting events with a much higher risk after first dose, even though it's still a very low risk. The risk of this after a second dose is even more rare than after the first dose. I think I said that correctly. And then, of course, we have to talk about the alternatives, which are, listen, if you're not comfortable getting a second dose of an AstraZeneca vaccine, hey, look, there's other vaccines available, like the mRNA vaccines, and there's just a growing experience and a growing body of evidence demonstrating that that's a safe and effective approach as well.
Okay, but in many jurisdictions of this country, it has been, vaccines are being rationed out. Does this now mean then that people who received AstraZeneca, the 2.1 million Canadians who got that as a first dose, does that mean that they can actually now choose what second vaccine they want, or is this still going to be rationed out?
Well, yeah, it looks like it's going to depend on the province. So, for example, in Manitoba, it looks like you will not have that choice. It looks like if you received the first dose of AstraZeneca, your second dose is going to be an mRNA vaccine. I have a feeling in many of the other provinces, though, there will be a choice. And some people will choose to get a second dose of AstraZeneca, and others might choose not to and choose to get a second dose of an mRNA vaccine. So it looks like that there might be some differences across the provinces for that. However, I mean, we still don't have enough vaccine in the country, for example, to snap our fingers and say, hey, everyone who wants a first dose and a second dose, come on and get it. Like there still is some scarcity of these vaccines. And that's why, for example, when you're looking at the rollout of the second doses, you're seeing some prioritization with, for example, people on the older end of the spectrum and frontline healthcare workers and specific medical conditions prioritized in many settings. But throughout the course of June, July, and August, we will probably have enough vaccine in the country to really offer most Canadians who want a 2-dose vaccine series.
And what does this do for a timeline? You know, I think people were thinking late August, maybe September, maybe October, before everyone, or at least those that want it, will actually be fully vaccinated. Does this mixing and matching now speed up the vaccine rollout into getting second shots into arms right across the country?
Yeah, I think it does, right? Because it provides more opportunities for vaccines and for second doses, right? If you have many people who are choosing to take a second dose of AstraZeneca and we have another shipment of AstraZeneca coming in, great. If you have many people deciding to take a second dose of an mRNA vaccine, we have tons and tons of Pfizer coming into the country, great. The other interesting thing here that was reported was that NACI was also going to give the green light to mixing and matching between mRNA vaccines. So this was reported in many media outlets, including the CBC. So, for example, people who received a first dose of a Moderna vaccine could get a second dose of a Pfizer vaccine. I think that's an important point as well, because quite frankly, we do have large regular shipments of Pfizer. And we do have, intermittent regular shipments of Moderna, but sometimes there's less Moderna in the shipments and sometimes those shipments are delayed. So again, it just provides more flexibility within the system for people to get a first and or a second dose at the right time. And it quite frankly, it wouldn't matter if you got a Pfizer or a Moderna vaccine, because you could just go and get the next available shot at whatever clinic's offering whichever product. So more flexibility, more opportunities for second doses, speeds up the process, makes the process a lot easier. I mean, I think it's good news.
We'll end it on that note. Always nice to end on some good news. Isaac, thank you for this, Dr. Isaac Bogosh.